All right. Why don't we get the show on the road here? What I'll be talking about is really more about the test preparation. My name, for those of you that don't know me, I'm Mike Shavanik, and I've had the opportunity, not only, I've taught here since '96, but since about '97, '98, I've been one of the facilitators for what's called the Licensing Exam Review course. And what that is we, every 3 months, we provide a training, and it's sponsored through NASW, the Coalition for Social Workers, and the Clinical Society. For a number of years now, I've certainly helped social workers prepare for this exam. And I also had to take the exam actually in '97, right around the time when I started teaching here. So I was a little nervous. I thought if I didn't pass the test and I'd be teaching methods, it'd be a little embarrassing, but I did pass. The thing to remember is that, again, everybody in this room is really in a pretty good position because you are, the thing about the exam is it's really testing your knowledge, your ability to understand the language of social work. And you are sort of submerged in that right now with all your courses. So you are much more familiar with the concepts, the ideas, the frameworks that they're going to be talking about in the exam. So that's why when Michelle was talking about earlier about the high test scores, I think that's part of it, is that those of you that are in school in some ways have an advantage to those that are maybe have graduated and been out in the field for maybe 5 years or a number of years and are coming back to get their license. So that's something to keep in mind. So what I'm going to do today is just kind of give you an overview of kind of strategies, some ideas to think about regarding the exam, and then I'll give you just a few practice questions so you know. It's all set up the same way in terms of multiple choice, or what I like to call multiple guess. Either way, you have some, we'll give you some strategies to think about the exam. So let's see here. I can use it. Oh, to click it? Just click it any place? Oh. No. This one? No. Oh. I could just use we can go to low tech. All right. All right. So what you have here, and actually you can look at the percentage of different areas in terms of the number of questions that are going to be in these various areas. And I always suggest you should look at this first, because you want to study smart in terms of, so you want to think about in terms of devoting your time, what areas do you think you need the most help with? And as you can see, human development and diversity, behavior in the environment, that is a fairly large chunk of the questions. So that means in terms of your human behavior courses and human development, those are the things you want to make sure you study. And of course, then the other large chunk is assessment, diagnosis, and intervention. And then there's these other areas in terms of micro practice. They divvy it up in terms of micro practice and macro practice. And of course, in terms of research, there aren't any, in terms of that area, there isn't going to be an area with specific research questions, but what will happen is that you will have probably a few questions around evaluation, program evaluation, and clinical practice research sorts of topics. You'd have that in maybe macro practice area, a few questions there. So anyways, it's always good to look at this first. You can actually go to the website and they'll provide sort of what the percentages are. And they also have what's called these knowledge statements, which are sort of an outline of the different topic areas that'll be covered. So I really recommend you take a look at that site, and that will familiarize yourself with kind of the general things that they're really, the types of knowledge that they're really looking at. All right, in terms of the exam, the exam itself actually started out, they did a job analysis of what do social workers do across the country. And so from that job analysis, they sort of broke it down into, you know, all these various tasks in these various settings that social workers do. And so that sort of was, and from that, those tasks, then questions get developed. So that's important to remember, is that, again, there's these action steps that we take as social workers, and so it emphasizes sort of taking action. And again, the test questions are getting developed by, it can be practitioners, it can be faculty members that are developing these questions, and then they get entered into the exams. One of the things you don't want to do is, when you're taking an exam, to fight with a question. I always recommend that if you're really angry about how bad some of these questions are, that you actually, once you pass the test, you can actually apply to begin writing questions. And they actually will pay you, I think it's something like $1,000 for a collection of questions. So, but do that after you pass the test. Let's see, what else here? One of the most important things to remember is this one over here about that 20 out of the 170 questions are not being tested, are not being used for your score. So what that means is you don't want to fight with any question, because that may, if you spend a lot of time on one particular question, that may be one that's not even being counted. So I think that's one of the most important things to keep in mind. So I always recommend that you sort of get in a rhythm of answering the questions. Make sure you're reading it accurately, but you do it and make your best guess, and you can always check them and go back to them later. So you want to get into sort of a rhythm of routine and rhythm in terms of taking the questions, answering the questions. And you can always come back to kind of look at the ones that were more difficult. Let's see here. Then those questions that perform well on the exam are then moved to the item pool for each knowledge area. So again, those 20 questions are being tested to see whether they really make sense or not. And the other piece to remember, again, it's measuring minimum level of competency. So I think that's an important piece to keep in mind. So let's take a look at this. Is gives you some idea in terms of the types of questions that you're going to get. There's 3 levels of questions. The first is recall kinds of questions. So this is where they'd ask you about a concept, and can you define a concept? It might be something, what is an id or an ego, right, from a psychoanalytic model. So it might be, some basic concepts. The next level is application. So what we're talking here is, can you apply a practice model? They may give you a scenario and say, this behavioral model if you were applying this behavioral model, it would include the following things. And they give you some choices. So that's the application. And so it's and then the third level, which is considered the more complex questions, are the reasoning kinds of questions. This is where you're going to get a case study, a case story, and they'll ask you, what would you do first as a social worker? So as you can see, in terms of the level, the lower, between the LGSW and LICSW, probably the biggest difference is you're probably going to get, with the LICSW, you're probably going to get more of the case stories, more of the reasoning kinds of questions. So anyway, so that's important to know. How the questions are structured, again, it's all multiple choice. And again, each question has 4 possible answers. The right answer plus 3 distractors. And of course, some of the distractors, answer is true but irrelevant to the question. Answer too narrow or too broad. Answer is common misperception. Or answer is carefully worded, sounds plausible but is wrong. So you want to really pay attention to the distractors and see if you can't eliminate those from what you're choosing. I mean, even if you don't know what the answer is, if you can reduce the possible answers to, to 2, right? You have a 50% chance of getting it right, even if you don't know what the answer is. So again, I really recommend that you take a look at what the possibilities are and eliminate the ones that don't make any sense. Read the questions carefully. Remember, I think one of the things to remember is anxiety is our friend, right? You have to certainly having anxiety, you're going to be alert to what's going on. The challenge is you don't want to get over anxious and find your own strategies for making sure that you kind of manage your anxiety. But one of the key issues is most of the time when people don't get the answer correctly, it's because they haven't read the question. So make sure you read the questions carefully. Decide which general topic area the question addresses. Before reading any of the answers or hypotheses, or hypothesize about the answers. So again, a lot of times if you just cover up what the possible responses are and take some guesses, that can guide sort of your thinking about the question. And we'll give you some practice with that after we go through these tips. Again, make sure you answer every question, even if you don't know what the answer is, because you may get some right even if you don't know what the answer is. If you feel stuck on a question, make sure you again, like I said earlier, you can always go back and you can check your response and go back to it later. I also think it makes more sense to kind of get in the flow of the test taking and then come on back and take a closer look at it. And of course, in terms of stress management, breathing helps. You're learning things about cognitive behavioral treatment. Self-talk is very important. So be aware of that. Some of the things that your grandmother has probably told you about, getting a good breakfast, getting enough sleep, caffeine. Be careful about how much caffeine. If you're one of those that's, gets anxious for test taking, be easy on the caffeine, because that can just, of course, make things worse. The other piece is, remember that other people in the test-taking area may are not necessarily taking the social work exam. So if somebody gets up within 30 minutes, don't freak out. It's not like they're super geniuses, but they may be taking the bartending exam. Who knows, right? So just focus on what you need to do.
Mike, I found that earplugs were really helpful when I took my under.
Earplugs? Okay, that's a good strategy. Especially if you get distracted by other people around you. Think it through, because again, you want to be real focused on taking this exam. Some additional tips. Again, choose the most comprehensive answer that meets the specifics of the question. When in doubt, favor the client over the agency or family. Favor health over disease. Again, you'll get a better sense of this once you start looking at the questions. Choose the answer that preserves life. Choose the answer that begins where the client is. You've certainly heard that many times. Choose the most expectable answer. Choose the answer that meets the limits of confidentiality. So again, all those things to kind of keep in mind, kind of general overviews for when you're taking this exam. Don't choose an answer that supports stereotypes. Don't choose do nothing answers with the exception of middle or later stages of group treatment. One of the things I should mention about you won't have a lot of questions around group treatment. You'll probably have maybe 2 or 3, maybe 4 at the most. But the questions will be focused on the kind of group that, in terms of social group work. So it's a type of group work where you are trying to get the other group members to do the work, interacting with each other, compared to the type of group where you're kind of doing individual work within a group. So, of course, one of the key concepts for group work is mutual aid. So, for group work questions, that's the kind of group work that they're going to be asking you about. And, of course, with these various stages of group work, the middle stage is one where you're, again, encouraging the group to do the work. So that's the reason why the middle stages probably are more likely to be do-nothing kinds of responses. On team collaboration questions, don't exceed the limits of the social work role. And of course, you have to think of it as not just in Minnesota, because the test is a national exam. So think of it as a social worker in Kansas or a social worker in Milwaukee, or that if there's state or Minnesota sorts of things that impact practice, you have to think more generically in terms of your responses. When in doubt, choose assessment over treatment. So you want to begin, the idea is that social workers are planful about what they do. So make sure you think about assessment before treatment. On assessment questions, rule out medical conditions first. We talk about that in those of you that have me for psychopathology. That's certainly one of the important pieces, right? Because there's a lot of medical problems that mimic psychological symptoms. So ruling out medical conditions first. And this last one is really important. Don't read more into the question than what is there. Again, depending on how much practice you have had, I think the tendency is to use your practice knowledge and begin trying to read too much into the question. Just read what the question says and respond to that. Don't read too much into it. Okay, and in terms of resources, probably and again, this may not be as useful for you because you're already in a social work program, but the Barker Dictionary is probably more useful for those that have been out of practice or out of school for a number of years. But the Barker Dictionary has all the social work types of concepts. But definitely use your current books, textbooks. That will help you as a refresher. Hold on to those PowerPoints that professors provide. That can be really useful. So pretty much what you'll be doing is sort of trying to refresh your memory in terms of what these major concepts are and these theoretical frameworks. So. Okay, and the DSM, certainly given the number of questions that are on assessment, you want to make sure you have the DSM and probably the larger version, because it has that section that talks about differential diagnosis that compares between various diagnostic categories. That's usually important. That's usually the way we learn these diagnostic categories, is comparing them. So make sure you get access to that larger book. Yeah. That's a good question. There, in terms of the DSM-5, in terms of the exam, actually you won't get any questions about the DSM-5 at least for about 2 years out after I think the publication of that is going to be in May of this year. And so, and actually I think they say something, they talk about that on the website, on the website board, but it takes at least 2 years they have to develop questions, and then they have to be reviewed. So there's going to be at least a 2-year lag time. So the good news is, at least for all of you, as you take your exam, you won't have to worry about the DSM-5 on the exam. Okay. Well, let me move. Any other questions before we move into the actual test questions themselves? Just have a few here to kind of. Oh, the other thing that you can do also is, in terms of getting practice, I would recommend getting practice, getting familiar with these test questions, because again, typically you're going to have, 2 possible answers that are really close, and the other ones will be distractors. But you can. There's on both campuses in the reference section of the libraries, they have the ASWB a practice manual in both campuses. So that's something you can access for free. You might want to take a look at that before you actually purchase. If you want to purchase, I think Michelle had talked about the ASWB website that has some questions you can purchase. But again, before you do that, you can certainly look at these test manuals that are available at either libraries. Okay, so give me a second here. I'm going to get out of here and just get to the test questions here. Okay. All right. So we're going to do just a few, just to kind of whet your appetite for these questions. And actually, I've actually pulled some of these from the different areas, so you have a sense of what these questions might look like. Okay. A woman whose child was recently diagnosed with a serious and possibly terminal illness is referred to the hospital social worker. The woman tells the social worker that her child is not ill and won't need to see the doctor again. Which of the following defense mechanisms is represented by the mother's response? Any thoughts about that before we get to the answers? I hear the D word. Let's see what we have. Rationalization, denial, displacement, or intellectualization. Okay, and of course, the answer is denial, right? So again, that wasn't so bad, was it? The other thing I should mention is, in terms of the psychoanalytic model and defenses, tend to get emphasized in this exam. Now, I don't know if that's because, depending on who the faculty, if there's faculty writing questions and what their training is, the time lag, right, in terms of different models that are seen as relevant as most important, depends on your training. So there is, I think that's something to keep in mind, is that some of our more cutting edge sorts of material isn't going to be in the exam. There's a time lag. There's at least a 5-year or longer time lag for some of this. So let's try another one. A social worker has learned that a father becomes angry when his 2-year-old son spoils or wets his pants. The father's usual response to this behavior is to severely spank the child. The father's behavior most reflects Okay, do you have some guesses? Some thoughts in your head? Okay, let's see what the possibilities are. A need to explore his relationship with the child, a distorted perception of developmental milestones, C, a need for developing new ways to cope with stress, or D, displacement of his anger towards his wife. What do you think? B. I hear mostly B's, huh? And you're right. All right. Why is it B? Those of you that selected B, why was it B? What's that? Right. So that's a distractor. Toss that one out. Good.
It's in the development area.
Okay.
And B
Yeah.
is the developmental milestone, so that goes with the human development.
Exactly. Although they won't have it labeled as,
Right.
so I allowed you to cheat a little bit here. But that's exactly the thinking. Yes?
Would it also focus more on assessment than treatment? And C sounds more like treatment focused.
Good. Yep, exactly. Good job. Okay, here we go. A client J is absent from 2 consecutive group sessions without contacting the social worker. On J's return to the group at the next session, the social worker should A, explore J's desire to terminate, B, encourage the group to address J's absences, C, facilitate the group in welcoming J back, or D, proceed with the group session. Now this is social group work. What do you think? How many say C? Okay. Any other options? B? Let's see what it is. Oh, okay. So, the person that picked B, why did you pick B?
I think because you said it is a group that is doing the work and not facilitators on C. So that would have been me facilitating.
Okay. Everybody hear that? Because the group, because the use of the group, it gets emphasized in this question. Okay.
You also don't know which stage of the group they're at because you have more structure during the beginning stages of the group work and the ending.
Mm-hmm. 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 Yep. So, let's try another one. To attempt to extinguish a child's talking to himself in class, a social worker using a behavioral theory approach will first determine how frequently the child talks to himself in class, meet with the child individually and ask to whom he is talking, include the child in a group for children with delayed social skills, or D, remove the child from the class each time he begins talking to himself. A. A? Okay. Okay, let's see. Yeah. I threw you off there. Okay, and why is it A? Why is it A? Assessment, right? Assessment before taking action. Okay. The desire for control and perfection and characteristic of which of the following personality disorders? Okay, now think about your personality disorders. A, borderline. B, narcissistic. C, obsessive compulsive. Or D, antisocial. C, yeah. Okay. When a client's behavior is particularly resistant to extinction, the behavior is likely to have been maintained in the past by consistent reinforcement, B, consistent punishment, C, intermittent reinforcement, D, intermittent punishment. Client's behavior particularly resistant to extinction, the behavior likely to have been maintained in the past. Now, this is one where you'd have to know about reinforcement, right? Knowing about the behavioral model and different types, different kinds of reinforcement. Okay. What do you think? Okay. Should we see what it is? Okay. Why is it C? Why is it intermittent? Right? Yeah. Also, I think intermittent probably is the strongest reinforcer, right? Because you never know when it's coming. It's similar to our work with clients, right? When some get better, some don't, and it keeps us in the treatment with clients. So we get intermittently reinforced by how our clients do. So again, the behavioral model and knowing some key concepts in the behavioral model is going to help you with this question. Okay. The view that learning takes place through observation and that new responses are acquired through the process of imitating models is associated with, before we see the answers, this is a recall question. So it's trying to recall a concept. Any guesses on what it might be? All right. Should we see what the possibilities are? Cognitive behavioralism, operant conditioning, social learning, or classic conditioning. C, yep. Yeah, social learning, right? So again, a recall kind of question. All right, another group question. In the beginning stages of group, Mary cries and the group remains silent. You would ask Mary about her tears, comment on the group's silence, suggest that another group member console Mary, or do nothing and see what happens. Now, are there any we can toss out? C and D? Okay. Right? Because that's in terms of using the group process. Okay. So we got two left. Right? Which typically happens. You have two that are fairly close together. So, how many say A? Okay. How many say B? Okay. And the B's have it. Okay. And why is it B? Yep, exactly. Yep. Okay. All right, it's like a soap opera. We need a little music. The group continues. Several months later, Susie cries and Mary reaches over to comfort her. You would comment on Mary's urge to rescue Susie, ask Susie about her tears, wonder what the hidden agenda is, right? Or do nothing and let the group handle it. Yeah, this is the do nothing example, okay? Depending on, again, this is the middle stages of group work. Okay. A man aged 30 comes to therapy with a variety of complaints. He says that for 3 years he has been plagued by chronic mood swings. He says that during his low periods, he loses all interest in his favorite activities, and during his high periods, he has so much energy that he feels out of control. Through all of this, the man has maintained a good marriage and performed most of his duties at work. So, any thoughts on what this one is?
Determining a diagnosis or what?
Well, yeah, it's giving various diagnostic categories. So there's one, bipolar disorder, major depression, cyclothymic disorder, or D-panic disorder. Okay, A. Any other possibilities? C. Okay. So A or C? And it's actually C. Now why is it C? Cyclothymic. Exactly. His functioning level, right? That's the key piece here. Remember, in terms of distinguishing between, you have bipolar 1, then bipolar 2, and cyclothymic is sort of the third level. It all has to do with severity of their symptoms, so their functioning level. So if they're functioning well and not hospitalized, you're probably more likely to have cyclothymic disorder, or bipolar 2, possibly. But bipolar 1 is where the functioning level, the symptoms are very severe. And those are the people that typically are going to be hospitalized. Right? Okay? Let's see. I think we just have a few more here, and then we're done. A social worker is working in individual therapy with a 16-year-old female. The parents have signed the consent for treatment form. One day, the social worker receives a call from the parents who are concerned about their daughter's current behavior. She is withdrawn and appears depressed, and they think she is using drugs. They would like to know more about their daughter's progress in therapy and ask the social worker to tell them what has been happening in recent sessions. The social worker should, well, let's see what the options are. Tell parents everything that they want to know, since they have a right to this information. Inform the parents that in accordance with the agreement that was reached with them at the start of therapy, everything their daughter says in her sessions must remain confidential. C, reassure that everything's all right. You can toss one of these out already, huh? Invite them into a conjoint therapy session with their daughter after obtaining the daughter's permission.
D.
D. Okay. And why D? Mm-hmm. Yep. So you see? Again, the key, you want to toss out distractors, so then it'll make it easier for yourself. And again, it's the same setup. These are all set up the same way in terms of these multiple choice kinds of questions. So, all right. Any questions? Any other questions before we close up? Again, this is the main thing is to know that you're probably better prepared than most people are that are not in school. And again, it's, take a look at use the textbooks to refresh yourself, and get some practice with doing the practice questions. And I think you're going to be fine. All right, well, thank you, and may the test gods be with you. All right, thank you. See you later.
Michael, I have a question.
Sure.
When did they talked about having the 12-hour session, like the learning prep?
Oh, the LERC program?
Sure.
That's what it's called.
Oh,
A
okay.
licensing exam review course at 12 hours.
Do we know when that is? Is it scheduled?
Well, they schedule it every. The most recent one was in January.
Okay.
And then the next one's going to be in April.
In April.
April, and it's always the fourth weekend of the month.
Okay.
You could call NASW and talk to Rachel.
Okay.
If you're an NASW member, I think it's like $165 or $170, but it's all day Saturday and then a half a day on Sunday.
Okay. Do you feel like, is it a lot of this stuff?
It's a lot. We emphasize there's a manual that you get, so you get at least some of the content. But our focus is on the test-taking strategy. So we spend a lot of the time going through these kinds of questions, and talking about why would you choose this one over this one. I think you're the best judge as to whether you think you need that or not. But it is a resource, another resource that's available.
Yeah.
And then we usually, whoever comes, we do a sign-up sheet, and then if you connect with people in the group, it might be a study group kind of thing too. So, but I would check with Rachel at NASW.
Get more information.
Yeah, and I think there's even something on their website.
Okay. Perfect. Thank
Yep.
you.
All right. Good. Okay, you're welcome. See you next week. Okay.
We said you were invited.
That last part,
I just
ibuprofen.
I don't know, my phone.
all smart and intelligent and trying to impress. And she's like, I said, how do you oh, I got described it anti-flatulent.
You're right.
And I'm like, but she was dead serious. And I'm like, hold it together, hold it, don't laugh, hold it. Like, I'm gritting my teeth together. And I'm like, anti-flatulent.
It's good to know because I was 3 years ago. What I do is, it's transitions to it's good to know that I'm more into
Oh, yeah.
Thank you very much. Appreciate it.
Bye-bye.
Bye.